Hello everyone and welcome to our presentation on reducing stage 3 and 4 pressure injuries in long-term care. We are a passionate team of 5 healthcare students. Let me introduce to our team. We have Kavita, Radha Yangden, Sandeep Kaur, Rosalind Wilson and Shalini. Together we aim to raise awareness and inspire positive changes in the way pressure ulcers are managed across the healthcare setting. Imagine being unable to move for a long period and the pain that builds in your body does not get a relief. For many residents in long-term care, this is a daily reality. But what if we could stop this pain before it begins? Hi, my name is Shalini and today, me and my fellow group members are going to focus on a preventable yet serious issue in long-term care. That is, stage 3 and 4 pressure injuries. These advanced pressure injuries are not only painful for the resident, but can also lead to serious complications like infection, longer recovery time, and even hospital transfers. They lower the resident quality of life and increase the healthcare costs. That's why preventing them is a key priority in Ontario Healthcare Quality Framework. At DEFRINOX, the current rate of stage 3 and 4 pressure injuries is 3.5%, which is higher than the provincial average of 2.5%, according to Health Quality Ontario 2023. This tells us that we need to improve, and that's why this project is all about making care safer and better for our residents.
Even though we have clear guidelines, there are still various barriers in preventing pressure injuries. And one of the significant issues is inconsistent risk assessment. It is often due to time constraints, staff shortage, or lack of education. Sometimes early signs of pressure injuries like skin changes can go unnoticed, particularly in people with darker skin tones. To overcome these barriers, the RNAO recommends using standardized tools like Braden scale and a head-to-toe assessments to be carried out with all clients at admission and daily thereafter for those who are at risk. Staff education. Engage caregivers in health teaching on pressure injury prevention, for example, by providing resources and quick reference guides. Repositioning. Making sure patients are repositioned on time using the right support surfaces and active participation of patients along with their family members in care planning can make a real difference in preventing pressure injuries.
I'll be talking about how reducing stage 3 and stage 4 pressure ulcer in long-term care can impact everyone involved. So firstly, for the staffs, it builds confidence in their ability to deliver safe and competent care. According to LeBlanc and team, when prevention strategies are in place, staff feel more competent and supported in their roles. And secondly, for the leadership, the benefits are equally important. Improvements in safety indicators not only reflect higher quality of care, but also leads to reduced healthcare costs as noted by Canadian Institute of Health Information. And most importantly, for the residents and the families, it fosters a sense of trust and security. Knowing that the healthcare team is actively working to prevent harm helps them feel valued, respected, reassured about the loved one's well-being.
I'll be presenting a concise 5-year pressure injury prevention plan. Year 1 is building awareness. We will integrate pressure injury training into staff orientation within the first month. Year 2 is encouraging accountability. We will encourage peer shares during shift change and the audit results at the unit level. Year 3 is educating and monitoring the whole process. Champions will monitor new staffs. Year 4 is sustaining and standardizing the whole process. Prevention strategies to be included in performance evaluation and appraisals. Year 5 is leading in an innovation. Train champions to lead quality improvement projects. This plan isn't just a checklist, it's a roadmap for cultural change. Thank you.
Leadership style is to inspire and empower their team by sharing the vision and approach in ideal for building motivation and strong team. This is commit to prevent the pressure injuries. So there is one theory that calls home self-care theory. In this theory emphasizes that nurse responsibility to care the resident who cannot meet their own needs. Many long-term care residents are not able to reposition by themselves and they are not recognizing the sign of skin breakouts. So nurses care staff help to protect them and maintain a skin integrity by providing a regular repositioning, skin checks and the comfort care. So there is a resources required like time for training sessions and for monthly audits like learning help them for the Braden scale and for the pressure relieving mattresses and moisturized management skill and wood specialized care and supportive staff.
Truly appreciate you taking the time to watch the video. Here are the resources we used.
Thank you.